Welcome, everyone, and thank you for tuning in to this month's Security Health Plan Academy. We're excited to partner with the experts at Exact Sciences to explore this month's important topic, colon cancer screenings. In just a moment, I'll turn things over to Dr. Paul Limburg, Chief Medical Officer at Screening at Exact Sciences, who will share why screening matters and how the Cologuard test offers a simple, non-invasive way to detect colon cancer from the comfort of your home. But first, a quick reminder, please remain on mute throughout the presentation and submit your questions using the chat feature located at the bottom of your screen. We'll do our best to answer as many as we can before time runs out. If we run out of time, we'll be sure to include a response in the follow-up communication scheduled to go out later this month. Okay, that's it for me. Dr. Paul Limburg, you're welcome to get started.
Thanks, Ashley, and welcome everyone. Thank you for joining today. I do want to walk through some information that hopefully is useful to you about colon cancer screening in general, and then more about the Cologuard test. Just to kind of set the stage for the Cologuard test, the test is approved for average risk screening. That means screening for colorectal cancer in anybody, either man or woman, ages 45 years and older, that does not have any risk factors for colorectal cancer. And I'll talk about those a little bit. But in general, those would be if you've had a personal history of colorectal cancer or colorectal polyps, sometimes called adenomas. If you've had another colon cancer screening test within an established time frame that guideline groups would recommend, then you would not need to screen with Cologuard at that point. If you've been diagnosed with a high-risk condition for colorectal cancer, such as inflammatory bowel disease, sometimes called chronic ulcerative colitis or Crohn's disease, or if you have a strong family history of some colorectal cancers and other cancers that might cause an inherited increased risk for colorectal cancer. About the test itself, all positive Cologuard results should be referred for colonoscopy. There can be what are called false positive results, where the Cologuard test is positive, but nothing is found on the colonoscopy. Can also be false negative results, where the Cologuard test is negative, but a polyp or a colorectal cancer could be detected at colonoscopy. So make sure you understand the test, when it should be used, and most importantly, talk to your healthcare provider about any questions that you might have, and you can always contact the Exact Sciences customer support team for questions about Cologuard as well. All right, so with that background, colon cancer often develops without symptoms, but that doesn't mean it can't be caught early. And I've been doing this for over 25 years. I was in practice as a gastroenterologist, and I saw patients who were at risk for colorectal cancer. So this has been a focus of my clinical career and also now my extension of my medical career as the Chief Medical Officer at Exact Sciences. So today we'll talk about why you should screen for colon cancer. We'll talk in more detail about how the Cologuard test works and whether it might be an appropriate option for you, what to expect from the screening process, and then, time permitting, we'll answer as many questions as we can about colon cancer screening and other topics that you might have. All right, so let's start with general information about colon cancer, what you need to know and why screening matters. Well, colon cancer, or sometimes referred to as colorectal cancer, is often called the most preventable yet least prevented type of cancer. And that's because we know a lot about this condition. We know that there is a time frame when the cells that line the colon go from normal to precancer and then to cancer. And that takes a period of many years, sometimes even up to 15 or 20 years to go all the way through that process. And we know what some of the intermediate steps are along the way. And those are called precancers or polyps or adenomas, depending on what they look like under the microscope. And even though we know that we can detect those precancers before they become truly invasive colon cancers, there's about 60 million people that would be eligible for screening, but they aren't there yet. And groups such as the National Colorectal Cancer Roundtable and others have set a goal of 80% screening participation from individuals who would be eligible. And we're not quite there yet. We're somewhere in the high 60s or low 70s in terms of overall participation. So we've got some room to go. We've got some work to do to try to talk to groups like this one about when and how to screen for colon cancer. So knowledge is power. Getting the facts about colon cancer, probably not everybody's favorite topic, but understanding what this condition is and what you can do about it can help you take control. So we know that colorectal cancer is the third most common cancer overall. And again, it affects both men and women. We know that about 75% of people with colon cancer have no family history. So may not have any symptoms, may not have any family history, but just based on increasing age, that in and of itself is a risk factor for colorectal cancer, which is why age is an important milestone for when you should start screening. And you can see in the bottom right-hand side of this slide that the American Cancer Society and other groups now recommend screening starting at age 45. And over on the bottom left part of this slide, we know that screening is effective. When colorectal cancer is caught early, 9 out of 10 people can be effectively treated. We can even do better than that. We can actually prevent the condition if we can identify those precancerous polyps, remove them, then the cancer doesn't even form. So we've got tremendous opportunity, but I want to emphasize again on this illustration here what this looks like in terms of going from early to later stages of colorectal cancer formation. So when you look at the diagram on the right-hand side of this slide, the stage 0 is the earliest phase of the colorectal cancer process. This is when the normal cells begin to turn into precancers, and then they start to break through the lining. And you can see as you go from stage 1 to 2 to 3 to 4, not only does the abnormality get larger, but it also starts to break through into the wall of the colon or the rectum, and the red blood vessels or the green lymphatic vessels are important in terms of determining what stage the cancer would be at and really what the overall treatability is. And we know that when colon cancers are caught in those earliest possible stages, as I mentioned on the last slide, it can be much more effectively treated. So what we want to do is we want to be able to identify these abnormal cells at the earliest possible time point so that they are at that pre-cancer stage and can be removed by colonoscopy or through other methods. So here's what it looks like in terms of the overall survival after a colon cancer diagnosis. And this graph again demonstrates what I alluded to on the previous slides. If the cancer cells are localized, meaning that they haven't broken all the way through the wall of the colon or the rectum, the treatment can be so effective that 91% of those patients with early stage colon cancer are alive and well at 5 years. Now, if the colon cancer cells have spread to the lymph nodes that are near the colon, then the survival rate at 5 years goes down a bit. And for cancers that have spread beyond the colon into other parts of the body through those blood or lymphatic channels, then the 5-year survival rate is much lower at about 14%. So take-home point again here is catch the process early, find those abnormal cells, remove them so that treatment can be most effective. And starting at age 45 years is the general recommendation for screening to detect those earliest possible abnormalities. I mentioned a little bit about risk status and average risk, and I wanted to just go through some of the general criteria here that can help determine whether or not you're at average risk. So average risk would mean you have no personal history of colon cancer or certain types of polyps called adenomas. Sometimes there's another couple of types of cancers, serrated polyps. Your healthcare provider can walk you through what that terminology would be. You also would not have a family history of colon cancer or rectal cancer, no personal history of inflammatory bowel disease. And if you have a strong family history of conditions such as familial adenomatous polyposis, or FAP, or Lynch syndrome, which is another inherited predisposition to colon and other cancers, those would put you at increased risk and you would not meet criteria for average risk. The last one on this list, a personal history of having radiation treatment to the abdomen or the pelvic region. And that can happen in certain instances where maybe during childhood or adolescence or early adulthood, somebody may have had another health condition that would require radiation treatment to that region of the body. And again, that can lead to some chronic changes that would not be associated with an average risk status for colon cancer. So understand your personal history and your family history, and that can help determine when and how you should undergo colorectal cancer screening or early detection. Well, the other point of good news with colorectal cancer is that there's more than one option for screening. And on this slide are the three most common types of colorectal cancer screening tests that are recommended by current guidelines. The first one is called multi-target stool DNA test. That's the generic name for the test. The trade name is Cologuard. The middle one is fecal immunochemical test. This is a stool test that looks for blood in the stool. And over on the far right side of this slide is colonoscopy, and that is a endoscopic exam that can be done in office. So let me walk through a little bit about what these different tests are. So first, with the Cologuard in the blue column, this is a test that looks for DNA changes that are associated with colorectal cancers and precancers. It also picks up blood in the stool. This test can be done at home. The screening interval, if the test gives a negative result, is every 3 years. The process involves taking a sample of a stool specimen. Don't have to do any special diet or medication restrictions prior to collecting the sample. It's a non-invasive test, does not require time off from work to collect the sample and submit it. And insurance covers the Cologuard test in the vast majority of cases. If there is a positive Cologuard test, colonoscopy is the right next step. Well, looking at the middle column, this is the FIT test, or fecal immunochemical test. It looks at a single marker. It looks for blood in the stool that may not be visible just on simple inspection. A couple of key differences here. The FIT test should be done every year. There, again, is no special diet or medication preparation that's needed with the FIT test, and it's covered by insurance in most cases. Just like with Cologuard, colonoscopy is the right next step if there is a positive FIT test result on screening. Well, colonoscopy is a little bit different. Again, this is an in-office procedure. It doesn't need to be done as frequently. It's every 10 years if the results are negative and don't show any cancers or precancers. What this involves is a preparation in the 1 or 2 days before the exam, typically. Oftentimes, the clinician, the person doing the exam, will provide sedation, which will help patients sleep through the colonoscopy procedure. And then the scope is inserted and goes up to the top point of the colon and then comes back down. And if there are polyps seen or anything else that needs to be removed or biopsied, that can be done during the same exam. So 3 popular choices for colorectal cancer screening here. They each have their own different characteristics. And the main message is find a test that works right for you and get screened, because we know that screening can have a dramatic impact on finding cancers early when they are much more easily treated. All right, so let's go a little bit deeper with the Cologuard test. The Cologuard test is truly one of a kind. It can be done at home, sample collected and shipped back through a national carrier. Doesn't require time off from work, doesn't require a prep. It detects 92% of colorectal cancers, even in their earliest possible stages, by looking for that abnormal DNA or blood in the stool. Cologuard is fully covered as a benefit from Security Health Plan, and it's delivered right to your doorstep. So there is no need to go any place to pick up the test. It can be mailed directly to the home. With Cologuard, as I mentioned previously, groups such as the American Cancer Society and others recommend that the test be done every 3 years as long as the result continues to be negative. And since we launched Cologuard in 2014, over 20 million Cologuard tests have been completed to date. So it's a popular test, it's an effective test. We're partnering with Security Health Plan to bring preventive care through the Cologuard screening directly to your doorstep at no cost to you. The actual collection of the Cologuard sample and the return is very straightforward. We like to think about the triple S method. So set up, sample, ship back. Well, first off, set up. This is what this slide shows what the kit looks like. First in the box on the upper left part of the picture, and then the components that are within the box. There are very straightforward instructions that come with the Cologuard kit. It's easy to use, and there is customer support to help you all the way through the process if there are any questions. But really what it involves after taking opening the box and taking the components out is sampling a stool. And that just means that you would collect the sample in the container, you would scrape it to put a small portion into the accompanying tube, and then you would ship the whole container and the components back by scheduling a UPS pickup or by dropping off at a UPS location. The box comes with prepaid labels, so the process and the recording is very straightforward. Typically, when the kit is once the kit is returned, the result is available within about 8 to 10 days. So what about the results? What do those results mean when they're delivered back to you? Well, first of all, the test can yield either a positive or a negative result. A negative Cologuard result means that the test did not detect any of those DNA alterations or blood in the stool, and you're very unlikely to have colorectal cancer based on a negative Cologuard result. Well, what about a positive result? That does not necessarily mean that colorectal cancer is present. So the test is designed to pick up those earliest possible signals of a colorectal cancer or a precancer, but that diagnosis really comes when you have the next step, which is a colonoscopy. It's important to talk through these results with your healthcare provider or a telehealth specialist. After a negative result, know what the right screening schedule is for you. So again, with a negative Cologuard, most organizations would say you could screen again in 3 years, depending on your overall health status at that point. And just to emphasize again, after a positive Cologuard result, then a colonoscopy should be obtained, and ideally that colonoscopy should be scheduled for the earliest possible time when you can have that exam. So next steps, taking charge of your health is important. Screening for colorectal cancer is relevant to people 45 years and older if they're at average risk. Know your risk status, know your personal history, know your family history, and really follow these key points on this slide. First is colon cancer is one of the most preventable cancers, and it should be and can be caught early when it's most highly treatable. That's why regular screening is so important. We also know the Cologuard test offers a simple, non-invasive way to screen for colon cancer for average risk individuals. It's backed by science, trusted by healthcare providers, and it helps detect colon cancer and precancers early when it matters most. Last point on this slide, don't wait. Your health is worth it, so get screened today if you're due for screening. Understand when you should be screened if today is not the appropriate time for you. And before your Cologuard test arrives, you'll get a welcome letter from Security Health Plan to let you know it's on the way. Exact Sciences will stay in touch throughout the process, and when it's time to collect your sample and send it back, we're available for questions or to provide assistance anytime, so you'll know what to do and you'll understand the process, and it can be as seamless and as simple as possible. So with that, that's the end of the slide presentation. I think we do have a few minutes left, and I'll turn it to Ashley to help us walk through any questions that have been submitted.